Hey folks, welcome back to the show. Today's guest is Dr. Pamela Kryskow. Dr. Kryskow is a psychedelic researcher. She's a medical doctor and she is an educator, and she is the medical lead of the ketamine assisted therapy Roots to Thrive program that runs out of British Columbia, but is actually starting to expand across the North American continent. And we'll talk about that more in the podcast. But what the Roots to Thrive program is about, it's about solving for mental health issues, and it does it in a multi-tiered way. It leans heavily into community and connection. It's a 12-week program, and there's only a piece of it that leans into ketamine-assisted therapies that are guided with a medical doctor and a psychiatrist and a whole team behind them. They use all kinds of other somatic therapies. It is really a beautiful, beautiful program. And I think that, at this point, I don't think any of us walks around without either ourselves or knowing someone who's suffering with some kind of a mental health issue. So this is a growing issue. And I love Dr. Pam's approach to it because it is so multi-layered and doesn't just lean on one thing. So I'm going to let her tell you all about it. If you want to learn more about the Roots to Thrive program, just go to rootstothrive.com. And to learn more about Dr. Kryskow herself, you'll find that out also on the website or through LinkedIn, Dr. Pamela Kryskow. So thank you so much for being here, you guys. I know you have busy lives. Thanks for taking time out to listen to this podcast. If you are inspired and decide to leave us a 5-star review, I would be so grateful. And if you choose not to leave a 5-star review this time, that's a-okay. If you have any comments, questions, anything for me, please make sure to reach out to me through my website, which is natniddam.com. And that's all I got. Thank you so much for being here again.
Hey folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider.
All right. Well, this is a take 2, guys. Welcome, Dr. Pamela Kryskow, to the podcast. It is such a pleasure to have you here today.
It's an honor to be here. Thank you for having me.
Yeah. So the minute I heard you speak on, we're part of a group, I think it's Women for Longevity or Longevity for, I don't, something about women and longevity. But the minute I heard you speak in that group, I was like, yeah, we need to talk because, your area of expertise is it's so fascinating and it is so needed in the world right now. So I'm really excited about this. First of all, the application of psychedelics in medicine, and then your particular areas of expertise as well. But before we get into that, I think the way I usually start these podcasts is we try to give the audience a little bit of insight into your personal background and your journey of coming to where you are today, which obviously, you didn't go around saying, oh, what's going to be a fun thing to do? Or, I mean, maybe it's fun for you on a challenge level, but you certainly didn't pick the easiest field to practice your craft in.
No, I don't usually take the easy route, and I usually like to lean right into things that I feel are really challenging, and certainly things that I don't feel like I have enough knowledge about. I like to lean into those and really look at them. And certainly in medicine, some of the things that are the most challenging that we are not taught well, or we don't really often come out with a lot of skill sets in is dealing with chronic pain,
Mm-hmm.
dealing with mental health challenges and palliative care. And so in my medical training, I jumped into all of those and really took a deep dive in it and really wanted to, have a strong competency in those areas.
Yeah. But your background, you didn't just come out of undergrad and decide to be a doctor, did you?
No,
You've done a lot of interesting things. I was, we were talking earlier. I'm like, holy jumping, that's a journey.
Yeah, I've had a good meander through my life. My first degree was in criminology. And so that also helped set the stage for my interest in psychedelic medicines, because I knew all about the war on drugs. I knew where that came from, what that was about, and had worked on some projects about people that had gone to prison for long periods, and it was completely unjust. And then from there, in my summer jobs was forestry firefighting. And
Wow.
so that paid the bills for me to go to university. And then that logically, somehow in my mind, logically went into city firefighting. So I was a city firefighter in the Vancouver area for 8 years.
Wow.
And at that time, and then I went into medicine. So I got finished up my science degree and went into medicine. And yeah.
And here you are.
Here I am. Yeah.
And here you are. That's amazing. So you just said something about, obviously like chronic pain it's a massive issue in our society. And it has led to so many people ending up addicted to drugs and losing their livelihoods, losing their families, like mental health issues, like you name it. But you had mentioned earlier that, when you first became interested in pain and chronic pain, you did a lot of traveling and you met with a lot of different people. And so what did you see in those travels? Like, I'm sure you saw the good, the bad, and the ugly kind of thing. So
what I did is I focused on people out there, physicians, therapists, physiotherapists, chiropractors, anyone that was getting results.
Yeah.
That's what I looked for.
Yeah.
Who is getting results? And then I would track them down and ask, can I come train with you? And I would go wherever I needed to train with these folks that were getting the results. If you just stay in the mainstream training, you're often like really far behind, just because it takes so long for knowledge to be translated into training programs and into physicians or therapists. So I'd rather go right to the front and find out what is working. So like I said, I traveled the world to find and work with people that would help me have the best skills for my patients. And it gave me a mix of a cornucopia of skills
I would
that I
think
could pull
so.
from. Yeah. And I was pretty agnostic on what I used, what my philosophy is, what's best for this person in front of me based on their complexities and what they need. And so there's a real mix of, very medical procedures to very spiritual procedures. Like people's pain is complex. It is not, dealing with chronic pain is not a technician's job. It is, you really have to figure out, like, is this pain a physical pain? Is this a neuropathic pain? Is it a residual old pathway that's just still firing? Is it existential pain? Is it depression? Is it, I hate my job and I don't want to go back, and the body's saying, okay, let's make it too painful to go back.
Let's come up with the best excuse ever.
Yeah. And it's complex. And so there's zero one size fits all, but really listening to the patient and getting a sense of what it is makes a big difference.
So what are the different modalities you came across that you felt were the most effective? Because it sounds like, obviously I was really interested when you were talking about psychedelics, but that's one tool in your toolkit. From the sounds of it, there are many tools in your toolkit, which makes total sense, right? I mean,
absolutely.
Even when I was in nutrition school, I can't remember the name of the doctor, but in working with people with chronic pain, he was doing brain imaging, and he was showing on brain images the area of the brain that was it was almost caught in this endless loop, and he could find that spot. And sometimes, to your point, like physically, there wasn't really anything wrong, which is where people go to the wrong doctor. And he's like, well, there's nothing wrong with you, and he'll say it's in your head, which it actually is, but he doesn't mean it in the way that it is. Yeah. So I'm curious about, what are the different modalities that you were the most impressed with, or that surprised you the most, and you've kind of brought into your practice, as it were?
Yeah, I don't know that I was fully surprised about any of the modalities. I was skeptical always. I was always skeptical. I like to show up with that skepticism and let the modality or the person I'm working with convince me. Yeah. And of course, I mean, there's always a bias because I'm going to them. So I have the feeling that they will help, but there is a lot of things. It really just depends on what people need. Sometimes, it was really just the foundational stuff. People needed to know how to eat properly. They had to find a way to exercise in a way that they enjoyed moving their body, not thinking of it as exercise, but how do you like moving your body and getting out there and moving the body? How many people have chronic pain because they sit on a couch all day and they never get out for a walk or a couch, not a couch. They never get out and hug a tree or just sit on in a meadow and watch bees landing on flowers. Like these little things change people's lives profoundly. A lot of people's pain is connection. So really, I always started at the foundation of what it is. Like, do they have the foundational habits to build a strong house on, like fixing their body? And if they didn't, that was, I try to slip that in the cracks while doing, because, people come in and they're like, you have to do something to me to get better.
Absolutely.
So while I did something to them, tried to fill in the cracks about food, exercise, meditation, mindfulness, laughing, turn off the news. Like that was one of the things. If you're going to work with me, you have to turn off the news. You're allowed to watch comedy. That's it. Just rebuilding these things that everybody knows this stuff, but you have to action it. And the reality of so many things within medicine is, if people actioned the things that make us healthy, you would need doctors way less. And so our job as doctors is to integrate that, to bring that in and say, look, you already know this stuff, and I'm going to tell you to you again, only because I care deeply about you as my patient and I want you to get better. But I can't make you eat better. You have to eat better. I can't make you exercise. You have to move your body. I can't make you turn off the news, but if you laugh a lot more, you're going to feel better. And if you love pottery, then go hang out with people and do pottery, get connected to people, because connected people have less pain. So, and then there's the modalities, right? So sometimes it's structural. Sometimes they need to get their tensegrity back. I mean, their ability to move elastically. So that's working with one of the massage therapists that I had at my clinic, like, let's work on myofascial release, or work with therapists that this is all they do, like rolfing. Sometimes it was just simply that, like they just needed to get their movement back. Sometimes it was structural. I work with some chiropractors at our elite level. They work with Olympians and professional athletes, and they're magical. Like they need to see a patient 1 or 2 times and they're done, because they're that good. They're not on, they don't have this comeback philosophy. No, they go there, you fix them, and then they would come back to me. And 80% of the time, the people I sent to the chiropractors or the massage therapists, the next time they came to me would be for a hug. Thank you, I'm done, great, bye.
Wow.
Like it would be, they wouldn't have to see me anymore. So it's about knowing, having the humility to know that you need a big team of people around you with other skill sets that I don't have, to say, you know what, you don't need me, you need that person. You don't need me, you need that person, or go see that person and then come back, because then build on what they've done. So also other techniques, like, when does a person need like perineural therapy, which is a very simple injection therapy with dextrose, which works wonders. When does somebody need prolotherapy? So something like cause inflammation to tighten up things. And, many people, when I started doing it, they were like, oh my God, that's witchcraft. What are you doing? There's no proof for that. And well, now, every Olympian has probably had prolotherapy, right? Some of the stem cell stuff, I didn't really do much of that. There were other people that were much better than me to do it, so I could send it to them. And so it's really about that. It's like, what do you need to do? What movements do you need to do? What exercise do you need to do? What change in your brain do you need to do? And that's where the psychedelics came in for me, is I was recognizing a lot of people, we could get to this level, but this next part was existential distress, was trauma, somatic trauma stored in the body, or looping thoughts, or just the basic human issues of, I'm not good enough, I don't deserve better things, no one will love me, if everybody knew my problems, they'd hate me. Like these things are ubiquitous out there, and so common. And so that's where the bringing in the psychedelic therapies really help take people to that next level.
Yeah. Well, I love that you bring up trauma. I'm actually listening to a book, which I've been sitting on for the longest time, and I'm sure you're more than familiar with it, called The Body Keeps the Score. And I'm walking and I'm listening to the book on Audible, because when I'm sitting, I'm on my computer, I'm doing so many different things. So I use my dog walks to kind of listen to the book. And it's infuriating the degree to the resistance in the system to the idea that early childhood adverse experience, like those adverse childhood experiences that are remembered or not remembered, what a massive impact that can have on a person's ability to function in the world. It is really, and how in some people, it shows up, I guess, in different ways. It'll show up as addiction. It'll show up as depression. It'll show up as whatever. And it can also show up as chronic pain.
Yeah, absolutely. Well, and here's the thing too. I mean, sure, the system has had inertia on this, but so what? We can dance around that, right?
Oh yeah, no, for sure.
Just move around it, like, and go, okay, this is what I need. Now that I have this knowledge, now I need to action it.
Absolutely. Well, because of people like you, who are willing to look beyond. Yeah.
There's a lot. In any profession, there's a portion that are at the leading edge.
Yeah.
There are a portion that's in the middle, and there's a portion at the tail. Always avoid the tail people. Leave them in. Don't worry about them. We can't keep them up. They're never going to keep up to date. Don't worry about them. Like, just let them go. Find somebody else.
I love that.
And like, I always, like, this is a common thing. Like, if only the system. If we're the system, we change it. We're the ones. Like, we are the ones we're waiting for. Right? That I think that's a Rumi quote. Like, we are the ones that we've been waiting for. You don't have to put this on anyone. Just change it. Like, find the right person, find the right community, and don't try to change others. Like, just don't leave them alone. They'll catch up when they're ready.
Yeah. Or not, whatever. It's not.
It's not.
I mean, with physician, you called it skepticism. I call it curiosity. I think that the best physicians never lose their curiosity, because it leaves them open to the possibility that either there's something they don't know, or there's something new that can layer on to what they're already doing. So having that open mind and curious attitude and the willingness to believe there's something else is ultimately what makes the best physician or therapist or anything, like in any area. So how did you come to psychedelics, and what are the types of, so first, how did you come across psychedelics initially?
Oh, well, at self-disclosure, really, they found me at 15, and mushrooms did. Yeah. And it's always been ceremonial for me, very ceremonial, very thoughtful, very intentional, and never really thought anything of it. Never really knew anything about the really bigger scheme of the state of the world and what people thought about it. It was just always in my life. And but when it came to psychedelic like medicines in medicine, it really came, as I had an opportunity to do some training, and it was something I was really skeptical of, ketamine training. And I was like, whatever, ketamine, how could that help? And then I had my own personal experience in the training, and I was like, oh, this is really interesting, really unique. It was about to bing. I just wanted to turn it off. Where was
your personal ketamine.
Ketamine. Yeah. So I had a session, and I was really blown away. I went in skeptical, and I was like, wow, it really made a difference. And I thought, I really could see how this could be something I could bring into my chronic pain practice. And so I was working on doing that, bringing it into the chronic pain practice, thoughtfully finding the right therapist that I could work with. And then so we were just doing this, like we're bringing it in, and COVID hit. And so everything shut down. But luckily, this program, Roots to Thrive, which was a nonprofit, we ended up chatting, and they were a resiliency program that was already treating healthcare professionals and getting great results. And they were like, but we need to make it better. Are you interested? So we put our heads together. We rewrote the program and added in psychedelic therapy to take it to the next level. And so then ever since then, I've been working with Roots to Thrive, and we wrote it as a psychedelic assisted therapy program. We snuck it into a hospital. We got great results. We worked with nurses first, and groups of people that have mental health issues, not because there's anything wrong with them, but they work so damn hard.
And especially the last 2 years has demolished that profession.
Yeah, they take so much abuse, and and there's chronic pain with them, with all the things they do, moving patients around. So anyways, we put it into the program, and we saw, benefits. Like, nurses were going back to work, their PTSD was resolved, their depression was resolved, their anxiety was dropping. They had all this big toolbox of skills, because it's not just a psychedelic, it's a resiliency program, whole human health program. Yeah. And and I knew I had found my home and I had found my people. Like seriously, to be on a team where you absolutely adore every team member. There's zero hierarchy. We're all learning from each other. We're all leaning into conflict and problem solving. We're all there for the benefit of the patient and in collaboration with the patient to always quality improve what we're doing. So the patients are always saying, hey, if you did this, it would be better. If you do this, it would be better. If you do this, it would be better. All those things working together. It's just great. And it's, like I said, it's written as a psychedelic program. So we have psilocybin in it now, and we'll have that MDMA in it in the next year. And
yeah, that's amazing. Well, it's amazing that you honed in on that one particular group of people, because you're dealing with health professionals. So they'd be uniquely positioned to contribute to the program in a sense, because as a health professional, having a deep understanding of human physiology in the body, they would be able to feed into your knowledge base, as it were, as a feedback mechanism, rather than, not that this I'm sure has transformational benefits also just for anybody off the street, but never mind the need of nurses, which has always been high, but in the last 2 years has, exploded exponentially. And even their circadian disruption that is part of their job, like being in a hospital, which is an inherently not the healthiest environment. It's quite amazing. So maybe we could back up a little bit. And for listeners who don't know what ketamine is, could you just explain to people a little bit, what is ketamine? What does it do? How does it do what it does, kind of thing?
Oh, good. Yeah. Ooh, I wish I knew that answer, but it does.
As far as you know.
As far as I know. Okay. So yeah, ketamine's been with us for a long time. So it was discovered in the 60s. It was brought into use in the 70s, initially as an anesthetic for doing operations. Its psychedelic properties were noticed back then, but there was already the stigma around psychedelics. And so they actually called it a dissociative anesthetic when they probably could have called it a psychedelic-like medicine instead.
Yeah.
It's so safe. It's on the WHO list of essential medicines. We send any of our military folks, they go with the ketamine, because a syringe of ketamine, so that if they happen to have an injury, they can self-inject. So it's that safe. It doesn't cause any challenge with breathing. You can do operations on it very safely. It's considered the go-to in trauma. And so we've been using it for a long time. But even that far back as the 70s, there was some noticing of that it had some mental health benefits around depression and more, and around alcohol use in the former Soviet Union. Dr. Krupinski was using it there for alcohol use disorder, and later on he moved to North America, was doing it. There was a number of Mexican physicians that were using it for mental health wellness, or well, we say wellness now, but mental health challenges, psychiatric issues back then, as they would have said. And it's gained use because it has this rapid acting antidepressant effect, and in some people it has an anti-anxiety effect, and it allows people to get into this mind manifesting state of this psychedelic like medicine, where they can reset in a lot of ways, like if they have perseverating thoughts, looping thoughts, the ketamine can help break that, can help them go, oh, do I really need to be replaying this trauma over and over? In some cases it can give insight. They can say, oh, under ketamine, they can go, I can see why that abuse happened, and I also know it's no longer happening anymore, and I can see that it wasn't my fault, so I can let that go. And you get these insights of the bigger brain. It's kind of the way I explain it. It's not the explanation I use is to help it land with my patients, not how I would use it with my scientific colleagues. But it's like, if you think of like for some people, they going snowboarding or skiing, and thousands of people have gone down, and there's all these ruts. It can be like a snowplow going down, clearing the slopes and allowing you to make new pathways.
Right.
And so just having that, whether it is just needing to bring down the cortisol enough so that just even the momentary drop in the mood, or the overwhelm or whatever, and done with skilled therapists, people that can help integrate and give meaning and then move on. And then a
Right.
lot of people can also cut the tethers to the old story of I'm not good enough. I don't deserve good things. I'm not worthy of this. These things only happen to me, or I'm the only one that's ever been abused. I'm the only one that's ever, I'm the only doctor in the world that can't go back to work because I'm burnt out. Like all
Right.
these, they're just stories, right?
Yeah, there's this, it's the story in your head for
They're
sure.
not true.
Yeah.
No, they're not true. And so there's this ability, like many psychedelics, to just get this bigger view, like, oh, in context, my response is normal. In context, I'm not that person anymore. In context, like it gives a context to stuff. And also ketamine also has, it's used in chronic pain. We do ketamine infusions for people that have complex regional pain syndromes, and help like basically, reset so people can get out of these long, big pain looping processes. And but then you marry them together. So you've got somebody that's got, maybe trauma and chronic pain, and you kind of get the best of both worlds. But however, in some cases, the cautionary note is that in some people, their pain actually does get worse with ketamine. And what we're finding, we follow that very closely. What we're finding is sometimes people they feel their pain, but they're numb, but they feel their pain. And then as the numbness recedes,
they really feel the pain.
Trauma, then they really feel the pain. But then on the other hand, that's good because now they're really feeling, they're not numb, they're not dissociating from their own body, they're getting back in their body. They can start giving meaning to that, integration to it. And then when you can do that, you can move forward.
Right. So you're basically at that point dealing with the physical aspect of the pain. You've taken the brain, what's happening in the brain or the emotions, you've kind of moved that out. You've kind of cleared the path, maybe to. And
it's complex, right? It's way more complex. I think.
Oh yeah, these are all gross oversimplifications.
Yeah, and it's probably completely wrong in a way. Like we'll probably find out in 5 or 10 years that how we've been explaining it is completely wrong, and I'm okay with that. Yeah. I mean, I'm okay to be wrong. I don't. As long as we're getting the results. If people are getting the lives back, then it's okay. I'm okay not to fully understand the mechanism of action.
Yeah.
As long as, like, really ultimately the result is, are you better? Can you go back? Can you do what you want to do in life? Can you be the human you want to be? And I think it's okay for those of us to be like, that are still doing the science, still doing the research, is to be very curious and be okay if we're not exactly on, if we don't know exactly what the mechanism of action is. And in fact, most of the time we don't know the mechanisms of action of what we're doing.
I think one word to explain that is called humility. It's being humble enough to know that you don't have all the answers, and that, I mean, what's amazing is that you're able to identify the things that work and apply them even without having a full, and I mean, when it comes to the human body, how much do we really truly understand completely?
Totally. We've been working on the biome for like 20 years and we still don't know the optimal biome.
No. Exactly.
20 plus years. We have all sorts of businesses selling all sorts of products saying this is what you need. And the reality is the scientists that are deep in it still don't know what the optimal biome is for what's the optimal skin biome? What's the optimal gut biome? What's the optimal mouth biome? What's the optimal vaginal biome? Nobody really fully knows.
Yeah, but I think, I mean, to your point that you made earlier, is the people who are on the forefront using these things know that what's going to happen is they're going to apply whatever new learning we've gotten. It's going to hit with some people. It's going to totally miss the mark with others. And it's almost like you kind of get to help people in batches as you find something new that's going to hit the mark it's like nootropics, right? Like you take a nootropic formula. For me, it really lights up my brain. For the next guy, it does nothing. Right. So whatever pathways needed support for me got the help. And in this person, it's a different set of circumstances and it doesn't land. And I think the good companies know that. There's one in particular. They're like, look, if it doesn't work for you after 30 days, we'll give you your money back. Like it's all good. We're good.
Different. Everyone's different, right? Everyone's eating different. Everyone's getting different amount of sunlight, different exercise. And so that's the challenge, right? We're always trying to find this one size fits all. If everyone just did this, Oh, if it was that simple, what a boring world.
Yeah, no kidding. Although maybe we'd get to help more people. So you mentioned ketamine, psilocybin, and MDMA. So clearly these are all three very different therapies that have, do you find that like ketamine will work for some people for trauma versus other people need psilocybin, or do they have different applications because they're different therapies?
A lot of that we're still figuring out. Our program. So the way we delineate it in our program right now, ketamine is a legal prescribable medication. So we use that in our primary program, the Roots to Thrive program. That's what we use. And then we also have a Roots to Thrive non-ketamine. So people that don't want to do any medicine but want to do the resiliency program. And then we have the Roots to Thrive psilocybin, which is for people with end-of-life distress. So we have to get a special exemption from the health minister on that. We have to get a special access, and that's challenging right now. It changes bit by bit. We got first off, we got Section 56 exemptions for our first set of patients. And we do only group therapy, by the way, because we feel like people heal faster in community
Together. Yeah.
All of us have done one-on-one therapy with psychedelics. All of us have done dyad work with psychedelics. That's just a model, and it's not the model we use. We feel like people need connection, love, collaboration. They need community to heal with. And all of us have seen that in group.
Yeah.
People heal faster, and they hold each other to their healing more.
Yeah. I mean, and plus they don't feel alone, right? Like I'm not the only one with this program, like already right out of the gate, feeling so isolated. And, people who have these problems end up closed up in an apartment, in a room, feeling completely cut off from the rest of the world, which has got to be a part of the trauma that they're going through.
And they're not alone. Like nothing anyone is experiencing on this planet, are they the only one?
Yeah.
Like it is not. And when you get siloed like that, you think you're the only one. And no, they get in these groups and they're like, oh, wow, that person has a lot of shame and I really like them. So maybe I'm likable too. And they hold each other like in this really lovely way. They get, and you just see it like as a physician or a therapist or any of our team members. We're like, wow. Like week to week, we see massive changes.
Yeah. Well, it's the light in your work, right? I mean, because you see so much darkness and so much pain. And, in order not to get swallowed up by that, it's what you see coming out of it is got to be the thing that just is so inspiring and keeps you moving in the right direction. So for psilocybin, you said that right now it's being used mostly for end of life. An end of life application. I watched a movie not too long ago, and I actually think it was shot in Vancouver, and it was about I'm sure you know this movie. It was about a young woman who had a serious crack addiction to drugs. I can't remember what it was. Yes. And in the end, it was psilocybin that, and it's fraught politically. It's such a charged issue because now is psilocybin now finally legalized in Canada for treating addiction, or still not yet?
No, well, and that's a great movie, Dosed. If you haven't seen it, it's really lovely done, and I believe they have a second one out now called Dosed too. Psilocybin has a lot more uses than the way we use it. We've just started with the palliative part because it's hard to be denied medicine when you're palliative, right? So we can make a really strong argument. There's also, even before the war on drugs, there was strong evidence that psilocybin helped with addiction, alcohol, and many other things. Obviously, I mean, many of the big studies right now are around depression. There's 97 clinical trials registered right now on psilocybin for multiple uses, from eating disorders, opioid use disorders, substance use disorders, depression, anxiety, and probably more that I'm missing, disordered eating. And so there's a lot of things, but I mean, I think when you really look at, talking about Bessel van der Kolk's book that you brought up when
The Body Keeps the Score.
Thank you.
No worries. I can't remember his name, so I got the title.
And Dr. Gabor Mate wrote on this like over a decade ago too. When the body says no, and then the body keeps the score, that the root of many of these things is trauma.
Yeah.
And if we ignore the symptom, which is what we do in the program, we don't care about your symptoms. What's the seed to get you better? And if we deal with the seed to get people better, again, building a strong foundation, the program's multifactorial for whether it's psilocybin or ketamine or MDMA in the future. But when we get to that trauma, whatever medicine, because it goes back to you asked earlier, which medicine for what? Well, who knows? And the bias is going to always be in practitioners is what does our experience tell us works?
Yeah.
And so my bias is basically what I've seen. Somebody else's bias is going to be what they've seen. But regardless, if we've got the patient's interest at the center and going, what is the seed of that trauma? How can you take it a few steps forward? How can you feel a tiny bit better? Then the symptoms, the eating disorder starts to come down. And some people it disappears, and other people it's much more deeper and needs more work. Same with the chronic pain. If you deal with the seed of the trauma, then the somatic disappears. So there's, it's really interesting. So in our case, we use what's available. And then as these other medicines become available, then we'll use them thoughtfully in that, and really thoughtfully, like what is in the patient's best interest, not what is in our interest. And that's one of the reasons we turned ourselves into a nonprofit. We wanted it to be zero profit. Like we said, any extra dollars every time goes into scholarships for the next group. So it's always a break even, and that's, energetically and morally, that feels right. That there should not be profit made on healing.
That's amazing.
Not everybody agrees with that, but that's just, again, that's our bias. That's just our bias. Other people can do what they want.
Well, it gives you freedom. At the end of the day, it gives you full freedom. You're not tethered to a company trying to prove that something works or whatever, right? You keep that curiosity fan as wide open as possible to be able to catch anything that comes into your sphere of awareness, I guess is the best way to put it. What did I want to ask you next? There's so many things. So with the ketamine, and I'm going to guess that it's rarely a one and done. Like, I mean, I would imagine this is like a process of unpeeling, if ever there was a peeling back of the onion, this is what this is about, really. It's about sitting with people and holding space for them and helping them, because you're really guiding them at some level, right?
Yeah, we're facilitating their healing. We tell them very bluntly, you're your healer. We're not your healer. There's no such thing as somebody else being somebody's healer. We heal ourselves, period.
Love that.
We do like that. We stand strong on that. You are your own healer. And we're facilitators of that. So we help, we offer, we set the buffet table of options.
Yeah.
We say, you could do this, you could do that. We only offer things that we know work. We don't offer any crap. We like, these are the things that move you forward. You pick up what you can and start there. Half a step forward, any step forward works. You're not going to go backwards. Once you know something, you know something. You cannot unknow something you know. So whatever you learn in your psychedelic therapy session, whatever you bring forward in your integration, whatever change in your eating habits or your exercise or getting in nature is now that's your new level. And you're always proceeding from that level. And sure, more trauma may come up in your life. Sure, there may be something else that it doesn't set you back. It just takes you from where you want to be. But now you have this new knowing. Yeah, and you can action that. And so that's our whole philosophy is we're offering stuff that works, but ultimately people have to become their own superhero. They have to go, I am the one that's in charge of my healing, and I can solicit others' help, but I ultimately have to see that I am responsible. Otherwise, people are externalizing, I'm broken because that person did this. I'm broken because that person did this. I'm not better because of that doctor or that. Well, you're on the team. Like you're the consistent person on your team. So you have to be your own superhero, your own healer, and use the rest of us in a collaborative way.
Yeah.
What we can offer and take every little piece into your healing that helps, even if it's 1% here, 2% there, 7% there. There's very rarely a home run. So like you said, peeling off these layers, like okay, let's get this layer off. And now what? Now who am I? Now
Yeah.
what do I need? Oh, that. Okay, great. Let's bring that into my life. Take off that layer. And now what do I need? And
Oh,
take that. And
I
so
love
it's that
this.
that
Yeah.
complexity of people being able to do it and then take it back.
Yeah,
You
well, the
know?
empowerment that the empowering of the individual, which I think so many people lose, right? Because either they've been told or they've grown, we're, I think less so now. I think it's changing. People are they're taking back ownership of their health and their outcome. They're less willing to hand it over, but there's still a huge generation of people. And frankly, I always think that it's scary to people to hold that power, right? Unless you're working with the right practitioners, it's a big responsibility. And wouldn't it be so much easier if you could just say, oh, that person's going to fix me, right? I mean, at some level, it's reassuming that and assuming it in a positive way, like you're saying, like be your own superhero. And it doesn't mean you have to have all the answers.
No.
But you're the captain of the ship here. You're the one living in the vessel. So
exactly. And that may irritate people to hear that. And if it irritates, for the people that it is irritating to hear this, it's okay, you'll get it.
Yeah.
Like one day you'll turn a corner and go, oh, I totally get what they were talking about. And we're going to cheerlead you all the way till you get there. But you have to look out in the world and go, what is the one thing I can do today that'll make it a little bit better? And even if the trauma and the insanity and the grief is overwhelming, breathe. Breathe. Start there with breath. Start with podcasts of people that can take you forward, not backwards. Like you don't want to be wallowing and with other people that are taking you down. Like you want to be going, what takes me a little bit up, not down.
Yeah.
And it is step by step, but I promise people, like our whole team has come from our own challenges. And so we deeply know this. And that's why we're on your side. We got this. You're going to get it. Just got to find the right combination of things for each person. And then they get there. And that, again, this is why we're kind of evangelical in a way about group work, because the team is so multidisciplinary. So you've got me, the doc, we've got psychiatrists, we've got psychologists, we've got nurses, got therapists, we've got somatic body workers, energy workers, we got Indigenous elders, we got Indigenous knowledge keepers, and we all hold that container. Wow. And all that knowledge comes together. And you can see how when you have every possibility, we have functional medicine experts, we have sleep experts, we have palliative care experts, and we all work in a non-hierarchical way to say, what does that person need? What does that person need? And then those people start to get their power and go, oh, I need a little bit of that, a little bit of that, and do that. And then they get to the point where they don't need us. And so again, back to the layers, who knows? Some people, their layers fly off. They're good. They do like 1 or 2 sessions, 3 sessions, and they're like, I'm good, bye. And other people, 7, 8, but we don't, again, we're not a technical thing. Like it's like you need as a person. And you're not other people. So you don't sign up for like 6 sessions. It's like, here's the program, complexity. And then as you leave the program, you go into the alumni. And what do you need as an alumni to take you to the next level?
I love it.
And it's a really wonderful model because people are getting they're getting what they need. And while they're at the beginning of it, they're held by a really strong team. And I encourage everybody that's therapists, like get on teams, work on teams, do some group work, because that's what you learn.
Well, it's funny you mentioned, it's funny you mentioned that, because I'm sitting here thinking like almost any medical practice should work this way, no matter what you're dealing with, whether it's chronic pain or whatever, because maybe there's some simple things, obviously, but even in coaching, as a health coach, I've seen that group coaching can be very effective because people form friendships and bonds, and they, as you said, like they hold each other up, they encourage each other, they cheer each other on, they learn from each other. I mean, we don't have all the answers, so there's so much information out in the world right now. It is kind of amazing how the right group of people. I actually had a women's retreat at the end of March, and a completely disparate group of women came together, except for two women came together as friends. And I'm blown away to this day of the way that they've remained connected.
Oh yeah.
And it was, I mean, we threw them into an ice bath when they came off the plane, which I think helped. You convince your brain you're about to die. All of a sudden, people around you are your new best friends because you didn't die.
Yeah, that shared experience. We see that all the time with the psychedelic medicine, even without the psychedelic medicines. Even people, we know that once at week 4 is the first psychedelic journey together as a group, and we see them like after it, they're family.
Yeah,
in a good way.
Yeah,
like it's and
codependence.
Yeah, no, it's like they're holding each other, and it's interesting because in the one-on-one work, it when you look, and again, this will just bug the therapist, and I'm sorry, but it's true, is that it's transactional, right? It is very, of course, like but but in the group work, like it's still transactional because the therapists are still being paid, but the patients are not, right? They're not paid to be there. They're not paid to say, you know what, maybe you don't think you've moved, but I've never seen you smile so much.
Right.
Like, since we've been in this group for 3 weeks together, and you are so much more expressive and so much brighter than the first day you saw, like you didn't even look up. And now look at you, you're sitting up tall. So those things that a therapist or a coach or a physician or a psychiatrist, can tell someone, and the patient, well, they'll believe us because we don't lie about it. But when others in a group that are traveling that same challenging journey say that to you, and they're like, no. And they're even more blunt than sometimes a therapist would be, right? They're like,
Right.
no, sister, you're wrong. You are better. Look at you. You are articulate. You are laughing, all these things. So anyways, the group work is amazing. And then again, for our own professional growth, working with others and seeing how they work and seeing what we like and what we don't like gives us our opportunity to grow.
Absolutely.
Because that tension is where you grow.
Yeah. No, I mean, I love working, even when in my one-on-one work with clients, I love working with a doctor for the medical oversight, and I've learned, it's funny. It's like the more experience you get, the more you grow up, the more willing you are to refer someone to someone else in another area, right? At the beginning, when you're a baby coach, you're like, okay, I got to know everything. I need to have all the answers. And as you mature, you're like, no, I can't be an expert in all the things. So you build your network of other professionals. And I think, to bring that to bear in the work that you're doing here is got to be so powerful, and coming across, because there's always new modalities, right? That you will come across that you'll be like, okay, well, that's interesting. Let's see if this fits. Yeah. But there's one thing I wanted to talk about a little bit. You mentioned that you tap into Indigenous elders. Is that because you work with Indigenous communities, or do you find that, I'm sure they do bring incredible wisdom. Will you have them working with people who are also not Indigenous as well?
Yeah, well, actually, right from the very beginning of our program, we had Geraldine Manson, who is our Indigenous lead, and she's an elder in the community, and she's an elder on our team. And we've had we have First Nations, other wisdom keepers on our team, and we're not tapping into them; they're just part of the team.
No, you don't hear about that, right? So much of the, I don't know if I should call it rhetoric, or so much of the awareness around Indigenous peoples is negative. It's so refreshing to come across someone who frankly respects and brings into the fold the wisdom that they have and the knowledge that they have, which is so deep, which has got to.
It's essential. Like, on one level, we're of course all Indigenous to the planet.
Sure.
Some of us are much further away from our original places than others, but we are respectful that we are visitors to the land here, like new visitors, and that we need to respect the ways of the folks that were here prior to us. And Canada's history is not spectacular at all, and so this is our work to contribute to healing as well. And we see it as what we call it, well, what it is called, it is and we embrace it fully, is two-eyed seeing. Is what are the traditional ways, seeing from one eye, and what are the Western ways, seeing from the other eye, and how do we co-create something better that uses the best of everything? And our advisors are saying, like, you know what, we've always done this, like always, we've always taken the best. As we meet other people, oh, your tools are better, let's use your tools, let's not go back, like, what, we don't have to stay using this when this is better.
Exactly.
And so just weaving them together, finding what's best and creating a new modality, letting go of what doesn't serve, taking in what does serve and is useful. And so everybody's there, like, so everybody's, and we have multiple cultures on our team. We have multiple viewpoints. We don't all agree on things, but we know how to lovingly lean into the tension and move through those challenges for the whole program. We have shakeups, and we're like, and then we come back together and say, because we fundamentally care deeply about each other, we can figure this out. And so it's just the weaving together. And we work, we currently run our program out of the First Nations Health Center as their guests. All of our psychedelic programming is in their center, and it's been such a privilege to be there. And we have many of their members that come through the program. Many elders come through our program, and then it's quality improvement constantly, because they're like, oh, well, we would prefer this, and we would like this, and so it's a co-creating of something better that suits them, and how they want to facilitate the healing of their own community. And we're just there again. It's a collaboration. It's like we're all hands on deck to help. And it's really nice, because when we did our first sessions at their center next door in the longhouse, they were drumming. And so, we could feel the drumming happening in the beginning of our ceremony. So it was absolutely wonderful. And we mess up, and we course correct, and we're just humans. Like, we're humans. I love the saying, I can't remember who said it. I should memorize his name, but it's really we're all humans trying to become better humans, so we can be better to other humans. That's what we want to do. And
cool.
And so it's that team really, it just really helps. And like you said, like, and I think it's even more important, like early on in people's careers, find elders and others around you that can mentor you and create teams. And we don't have to wait till we get older and realize we don't know anything.
Well, I mean, it's all what you're exposed to along the way, right? I do think that the earlier you, and I mean, most people have a mentor at some point, but finding, it's like finding the right therapist or finding the right mentor. I mean, you can find a therapist that seems to be a good fit. Sometimes I find you get to know your therapist a little too well, and they become like, it becomes too close, right? You lose that. Same with mentors, whether they're business or otherwise.
There's a thought on that I just want to put out there that is controversial for some people, but it's like, how long should you have a therapist? How long should you have a counselor? Like, really, like, seriously, like, we have people that have had the same psychiatrist for 12 years, and we're like, what the hell? Like, have you, like, clearly they're not effective because you're coming into our program. Right? Like, what have you, and we've had that so many times. So I think that's again, that critical look at ourselves. In my pain clinic, there was a number of visits at which I was like, you have to be drastically better for you to keep coming here. Like, we have to be working on, like, if people were not progressing with me, I'd have to stop and say, I am not helping you. We have got to find you somebody better than me. Right? Like, there should be a finite number of things that people are doing. Like, they should be graduating from our skill set.
I think. Absolutely.
And that's the challenge of the financial interaction. But if we all strive to constantly be better, so that the people that are coming in to get our services only need us for a finite amount of time. Then new people can come in.
Absolutely.
Right. And because they will come in because you're good.
Yeah,
right?
no, I totally agree. Well, and you get comfortable, right? So for the roots to thrive, I want to get back to the program because this is just an amazing program. So I would imagine that for people to benefit from your program, they have to be on site. Like this isn't a Zoom call. I mean,
Yeah,
ketamine
actually, no.
therapy. Do you do remote work
Again,
as
yeah,
well?
COVID changed everything, right? So we had to
Really?
experiment with everything. And so what we did is we transitioned the program online. So it's
Oh,
12 weeks
wow.
online,
Yeah.
but the three psychedelic experiences are in person. So we have people from all over North America that tune in to their group, the group work online. Everybody does. Doesn't matter if they're in the same community or not.
Yeah.
We're online with the small groups. It works remarkably well. We were very skeptical. We're like, oh, this is not going to work, or it's not going to work as well. But in fact, we've kept the program online because it works so well.
Wow.
And the nice thing is that people that have a lot of anxiety, like how better to do group work than on your own couch with your cat and your cup of tea, and you can sit as close or as far to the screen as you want.
Yeah.
And it actually, the feedback has been really remarkable. We were surprised, and I love that when we're surprised. That's where, again, learning happens.
You're learning. Yeah.
Yeah. And then they come on site. They come for the weekends. So many people fly in and will stay for a week because we do one session on one weekend. There's a week to integrate another session, and then there's 2 weeks in between.
Yeah.
And then the third session, and then all the integrations are online. All the meetings are online.
Wow.
All the support is online, and it's a full wraparound. So as people are integrating, and some people do fantastic. Some people need a little bit more wraparound. So the team is there for that, and that's again the wonderfulness of a team is that, you know, if it was just me doing the therapy, then I'm full on for doing all the 24-hour on call follow up, you know, as things are shaking up and resettling. Whereas on the team, you're all holding that. So
Yeah.
you know, this person might be doing this and I might be doing that, but we're not having to do all of it. And
Yeah.
that's really nice. It gives the participants a little bit of, you know, their own autonomy. It's like, you know, I need to talk to Pam, or I need to talk to Todd, or I need to talk to Shannon or Phil, and they can decide who they need to connect with to help and get them through the little shakeup. So yeah, so we have people from all across North America
I
that
love
are in
it.
our.
I love it. And so is there a vision at some point to expand this program so that you can have other programs like your program in other places? I mean, you know, because you're still only one program. You're going
We
to have,
actually do have satellites.
you
Yeah,
do.
no, we built the program on purpose to be able to scale it out. We knew that like this has to happen everywhere. As you know, there's therapy happening all over, and we have to have the best therapy at the best level. So we built it to be that way. And so we do have satellite groups now. We've trained a number of satellite groups. So first off, they come through the program to experience what we're creating. So their team comes through our program, and then they come on the other side and see the operations and the logistics, how we determine what each week is, how we determine the supports needed, how we like, you know, who we accept into the program, who we decline, and all of that. And then we mentor them in their own program so that they can create their own program in their own, what the culture of where they live.
Yeah.
And so their participants still come online with ours.
Oh, wow.
Except when they break into the small groups, they go into the Whistler group, or the Squamish group, or the Fraser Valley group, or the New York group. So they go into their own group, and that group of the healthcare team there in that satellite group also do the psychedelic sessions.
Perfect.
But they get the benefit of the bigger group. So they're in the meetings with the bigger group of our professionals learning, and we're cross-pollinating knowledge again. So the satellite group is learning things that maybe we didn't know, and they're like, hey, we've done this, it works better. So everybody's getting elevated to the best.
That's amazing.
technique.
That sounds amazing.
Yeah, so that was our intention right from the beginning, is to say, okay, come feel what we've made, so
Yeah.
you know what you're recreating. And everybody needs to have the opportunity to do their own, you know, work, to be
Yeah.
held, and really just find that nourishing spot. and them. And
Yeah.
so, yeah, that was our intention right from the beginning.
That's me. I love that. And I love the approach to, it makes so much sense with the psychedelic therapy, with the ketamine and the psilocybin, that it's really just one spoke of the wheel. I mean, it's a powerful spoke and it moves the needle in ways that probably nothing else can. But the way you've built this to be so holistic in so many different areas is really amazing, right? I think that's it, and it gives more credence in a way. Like, it's easier to break down the stigmas when you're saying, look, this is just a tool. This isn't our crutch. This isn't the one thing. This is a piece of a very powerful program. I wanted to ask you, just before we cut out, like, how, it's funny that we're having this conversation today. Yesterday, I was at an event and came across a woman that I've known for a long time who is riddled with pain, like legitimately, has had 2 knee replacements, 2 hip replacements. Now the arthritis is settling into her back. It's just like they're chasing the problem. And I know, and this is a person who lives in a high rise downtown. There's very little nature in their lives. And I'm, there's from a lifestyle perspective, there's a whole lot of wine and I don't know what the diet's like, the whole 9 yards, but that disconnect from nature. And obviously there are physiological issues in her case that have to be addressed, like the inflammation and whatever the drivers are of the process that's happening in the joints. But beyond that, like, how powerful are you finding like this whole connection to nature thing is? Because to me, if I could get her barefoot in the grass once a day, like, go find a patch of grass somewhere.
Yeah, if you want a different outcome, you need to do something different.
Yeah.
Right. Absolutely. And actually, there's one thing I want to go back to the program about that I think is really important.
Yeah.
That is another gap here is the program is not just service delivery, like not just therapy, but we also have 2 other arms. We have the training. So we're attached to a university. We're training professionals to do this.
I love it.
So,
yeah.
so the Vancouver Island University postgraduate certificate in psychedelic assisted therapy is a comprehensive program for people to say, okay, I have all these skills. I'm a therapist, or I'm a social worker, I'm a doctor, I'm a nurse, whatever. And now you're going to come together and learn with others. What is the cutting edge? What is the historical? What is the traditional? What is it? Where are we at now? And how do we go forward thoughtfully in community if we're going to offer these therapies? So we're connected to an academic institution.
Yeah.
And then over here, we're also attached to a research. We have a whole research team. So we're publishing on our results. So when we talk about so not only do we have great results, but we're publishing on it and we're telling others, like, this is what we're doing. This program in this way is getting these results. So we have a firefighter study coming up. We have veterans going through our program. We published on the nursing stuff already in Frontiers of Psychiatry. And we're continuing. But what we're doing is we're not doing, the placebo double-blind controlled trial, because the results are so good that it would be unethical to put anybody in placebo in our program.
Yeah, for sure.
So what we're doing with pragmatic trials is we're saying, this is what we're doing in the real world. This is the real world protocol, and these are the real world results. And we're publishing on that. And that will help other folks around the world be able to say, if you do really high quality, like if you replicate what we're doing, you will get these results. And that should help policymakers to go, this is legitimate work. And if you do it in a way that gets these results, you should get funded. And we already have insurance companies funding us. So we have workers' compensation is now funding people to go through our program. We're working with veterans to get them covered. We're working with the RCMP to get them covered. And, it's these are people that are basically about to get written off.
And this is so smart. Like, it's so, and in a sense, as holistic as your program is how holistic the program of the holding of the program is, having the affiliation with the university, having the affiliation to this research, like that is, it's its own ecosystem in a sense that is designed to expand. Right? Like you've created this whole system that is designed by its very nature to be replicated, to seed the world, if it were, as it were.
Well, and to calm and do exactly what we do in the therapy is to calm the nervous systems, right? To calm the nervous systems of the policymakers that they can be courageous and
Yes.
fund this type of medicine.
Yeah.
Calm the nervous systems of the people coming into our program, and calm the nervous systems of people that are training in this to go, oh, I can do this in community on teams and do it well, really,
Yeah.
really well.
Yeah. Yeah. No, I love it. And I think it's amazing. So, so as we're, kind of starting to wind down here, I want to respect your time. Is there anything else you'd like to say to the audience, and or as well as how do they learn more about the program? If it's something, whether they're a practitioner or a person on their own health journey, let's say, I'm not even going to call them a patient. I'm just going to say, a person who's pursuing their own health journey, how do they learn more about the program from both sides, or a researcher? I mean, we got all kinds of listeners.
Yeah, thanks. So I love how you said that. We actually call the people that come into our program participants.
Nice.
Yeah, that seems the most logical word right now.
Yeah.
So it's very simple, rootstothrive.com.
Yeah.
It is a nonprofit. So we run on all cylinders, a lot of volunteer hours and stuff. So they can always reach out on the website. Practitioners can connect on the website too if they need more information. And people can apply to the program through it, and also look for, if there's something in their area, we can let them know. Just
amazing. I love this. This has been the best conversation, Pamela. I'm so grateful that I persisted and finally made it to the top of your inbox. Where I could be seen.
Well, thank you. Well, I feel honored to be in this time and space and to be on the team. Like I'm the happiest I've ever been as a physician. I'm the most nourished I've ever been as a physician to work with a team like this, and also participants that are always getting better, up and down, but they always are a better version of themselves as they come out of the program. So it's really an honor to do this work. And I think it's just like, Wade Davis said very recently, I was at a conference with him, and he said, you have to do what's necessary first, and then find out later if it's possible or permissible.
Yeah.
And that's really been what this team has been doing, is like, this is necessary. We have to show up as full humans, healthy humans, first and foremost, to help others find their whole humanness. And that's what I suggest for everyone. Like, you have it within you. Find the people that can help you see it within you, and don't look for the home runs. Like, nothing's a home run.
Yeah.
If yoga gets you 5% better, keep doing yoga. If hugging a tree gets you 5% better, hug a tree. If getting out and laying on the grass and staring at the sky, if a vegan diet gets you better, use everything.
Yeah.
Use everything that feels better. Don't look for the home runs. There aren't home runs. It's a journey. It's one step at a time.
I love that. That's so important. Thank you so much. Thank you. Dr. Pamela Kryskow.
Yep. Like
the one thing we don't want to eat, not spelled the same, but pronounced the same.
Exactly. Yeah.
All right. So it's rootstothrive.com. So thank you so much again.
My pleasure. Thank you so much. I really enjoyed chatting with you.
Likewise.